The product is called Capillus. It is, we have some before and afters to show you, and we're gonna be giving you testimonials throughout this entire hour. We do have a true expert here in the studio, so we'll be able to, you know, answer all your questions, but take a look at the before and after results after 6 months of wearing it once a day. By the way, it's 6 minutes a day. 6 minutes out of your day. I just watched Kathy Wolf talk about brushing your teeth. That's about the time it takes to brush your teeth. You can stop the loss and actually regrow hair. And there's a young lady. This is not something that's solely for men. This is men and women have this issue. This is 12 months worn once a day. By the way, we have an extended return policy on this for 6 months. We give you 6 months to try it out, see it, returns and exchanges, okay, up to 6 months. 3 months worn once a day. Remember, it's 6 minutes a day. Take a look. You can see the, you know, a little thinning hair in the before, and it's like, now where was that in the after? Like, you try to, you know, kind of match back between the two pictures. It's like, where was that? And of course, as time goes on, just to be clear, this isn't an instant product. This isn't something that you spray on your head. This is actually regrowing your hair. It's an FDA cleared device. We're gonna take a listen to one of our favorite guests here at HSN, celebrity hairstylist Martino Cartier, with his very personal experience. Take a listen.
My name is Martino Cartier, celebrity stylist. When I turned 40 years old, I noticed my hairline was really starting to thin and I was starting to panic. So I found a hair restoration surgeon, world-renowned guy, right here in Florida. So I went to him and I had the transplant. I spent a lot of money and he told me, you really should protect your investment. And by doing that, I want you to get this Capillus laser cap. And what it's gonna do, it's gonna stop the hair from falling out that you already had with the surgery. Plus, it's gonna help other hair come in thicker and more fuller, like when you were younger. Being a celebrity stylist, I have access to the best of the best. So if I choose Capillus, you should too. FDA approved, clinical results, you're gonna love your hair.
Yeah, and you know, we have more testimonials. We have lots of information. This is one of the easiest things you'll ever do, but we would love to hear from you at home. We're here live. Our toll-free testimonial line is 1-866-376-8255. You can call us with questions if you bought it. Would love to hear your experience. I'm gonna introduce our special guest. Barry has worked in a medical office for years and years, hearing your personal stories and coming up with, okay, this is your issue, this is the solution. And that is the other place where this cap is sold, is in doctors' offices for more money, FYI. But Barry, I'm so glad, always love doing a show with you. You have all the answers, all the information.
You have all the questions, and I love that because that is what I did. Yeah. I sat with you in an office where you would come in and be concerned about your hair loss, and it was my job to explain you the options. Notice how I said options plural, because I'm gonna do that, because as I would say to them, as I will say to you, you might think, oh, he's here just to talk about that. That is not true, because it's super important to me that you know all of the available options out there that the medical community recognizes. I'm gonna lay those out to you. I'm going to explain what does an FDA clearance mean and why is that so important. We're even going to talk about why is your hair falling out, what biologically is happening, and what can or cannot the medical community do. So this is a consultation. It's you and me. It's me and Helen.
Yep.
Really, it's like the three of us, four of us, however many there are, questions back and forth. Please call in, give me your questions. I want this to be a real, and we talked about this, keeping it real to both of us is so important, because we don't want to pull fast ones. We don't want to do any slip sliding. We want to give you straight, honest answers to make a educated decision and choice.
All right, well, let's start out with, who is this for?
Okay.
Who is this for? Who is this not for?
Okay, we'll start there. What we're doing here is treating the follicles. Basically what's happening is we're born with healthy follicles and they die and go away. That's permanent baldness. So if you are permanently shiny bald, this is not for you. because that's something that if even as a possibility is to do surgery. However, if you have fine hair, like you saw in those before and afters, wispy hair, tiny hair, meaning a lot of hair that you cannot even see, this is perfect for you because we can reverse that hair loss and bring it back. Here's the Ludwig-Savin classification, okay? You've seen this. You see this in the mirror. If you're suffering from hair loss, you know this is you. The part is getting wider and wider and wider. See as it progresses there, the little dots, the little fine hair. Those are the follicles or hair that we are treating and bringing back to full-blown health, which is why we can say we have an FDA-cleared product that helps stop hair loss and helps cause hair regrowth. Quickly, let's look at the men. This is the Norwood-Hamilton classifications. Again, these are classifications we would use in a medical setting to chart you and describe where you are. Guys, you see yourself.
Is the gray, if you're in the gray, you can be helped?
Yes, so, well, the gray area is where we are specifically FDA cleared for.
Okay.
But honestly, Helen, truly, if first of all, I would get tons of number 2s coming and just want to be preventive, okay? Because, you know, people, they're freaking out, they're losing their hair. They don't want to be a 3 or a 4.
I see what you're saying.
But even the guys in the white, and from the ladies that were in the white at the bottom, remember, we can help stop hair loss. And we can regrow some hair. I just don't want to mislead them to know that they're going to kind of, like we saw Daniel with a full kind of head of hair. But to stop it and to bring some back, they're thrilled to do that. So it's really excellent for them as well.
Okay, and we also have a Fitzpatrick skin chart that we can look at. Tell us about that.
All right, so again, this is a FDA cleared product. What that means is human clinical trials were done. Human clinical trials, safely, sent to the FDA. I'm going to explain what an FDA clearance means because you're seeing a lot of that on the news, aren't you? You're hearing a lot of the words I've used in the last year, like efficacy and safety. But in these human clinical trials, there were specific skin tones that were tested. And that is what you're seeing right here above the line. Those were the skin tones on which it were tested, for which it was FDA approved. However, anecdotally, experientially, we know these darker skin tones do very well with low-level laser therapy or photobiomodulation. So that just shows where the FDA clearance was, but honestly, on all of them, you'll see great results.
Okay, so how does it work? I get it home, I open the box.
Yes.
I know the answer.
Yeah.
But tell everybody at home, how difficult, how easy is it to use?
Okay, it's amazing because we're talking about 6 minutes once a day. And when I get that question, that's when I go right into all of your options so that you understand how this compares to what you can and can't do. So let me make this very clear because it's one of the first things I hit on when you would come into my office, and that is, what are my options? Because you would say to me, Barry, please, would you just be honest with me? Is there something I can do? Is there nothing I could do? I just want you to be honest. At which time I would say, Mary, so let's talk about women first. You have 3 medical options that you can do to help stop hair loss and help cause hair regrowth. One is a topical, minoxidil, that you put on and leave on twice a day. You must put it on and you must leave it on twice a day to see results. If you don't, you won't see results. Some folks say, because some folks will say to me, well, I tried minoxidil, that didn't work, so this won't work. Incorrect. If you put it on and two hours later took a shower, it didn't work. If you stopped putting it on at night so it didn't get on your pillow, you weren't complying. You didn't use it correctly, so you can't use that as a standard. However, the medical community recognizes it. I do too. It's a vasodilator. It's a medicine that opens up your blood vessels and increases blood flow. Second one is PRP, where you go into a doctor's office, get shots in your head. You have to do that for the rest of your life. Basically, in about 2 to 3 months, it's the price of this cap that you buy once. The next one is, while I have it, photobiomodulation, or low-level laser therapy, okay? This is the third. So again, track with me, ladies. You had minoxidil, PRP, and photobiomodulation. Gentlemen, you have one more known as finasteride. That's a prescription medication you get from your doctor. It was and still is prescription for an enlarged prostate in a man. FDA requires me to say it can't have side effects, sexual side effects, and low lack of libido. But Helen, it's so important in answer to your question that folks understand there are 3 things for women, there are 4 things for men, and that's it in terms what the medical community recognizes. But this one, you buy once, the other ones you buy over and over again, and this one you use 6 minutes once a day push one button, and that's it. Eventually, we'll go over to our model and show you exactly how to use it.
Right, so you push the button and the light goes on, and by the way, it's a timed light, because after 6 minutes, you don't have to, I'm just telling everybody because I own this, after 6 minutes, it does a little beep, and then it turns off on its own. So you just have to do it 6 minutes a day. That is it. Now, it may not be the issue that everybody at home is thinking about, and I appreciate, I was just watching Lynn, she's right. You know, maybe you guys are tuning in just because you're like, you want to break from all the news, you want to chat with, you just want to hear somebody chatting. We're happy that you're hanging out here at HSN. As of now, we're here live, and we're continuing to be live, and we're bringing you lots of products. We do have lots of things on hsn.com, and we have everything from cleaning supplies to food that we ship out. This is something that is in our beauty category, and I know that in life, confidence matters, and if you're a woman with hair loss and we sell really great wigs here at HSN. I know a lot of you love our Gabor wigs, but this is something that actually regrows hair. It stops hair loss and regrows hair. I've been working in front of the camera since I was 17, so that's 40 years of working in front of the camera. I use this because I noticed, and Barry knows this, I've talked to him, I saw my front of my hair kind of thinning a little bit, and it wasn't, is that a big deal? Well, maybe if you make a living in front of the camera, it's a big deal to you, So I will say that using it, it's giving me a little more confidence. I know I'm doing what I can. I know Adam I'm not saying something that he doesn't tell everybody. Adam Freeman, one of our hosts here, he uses it. Yep. So it is something that we ourselves use here at HSN. Take a look at these before and after pictures. My favorite thing about this presentation is if you order it, you're not risking anything because you have 6 months. We usually do 30-day return policy. Actually, during this very unique time in our history, we're doing a 90-day return policy because we don't want you going outside returning. We don't want you going out there. So 90-day return policy and everything. This is 6 months. So I don't even know what day, I don't even know what month we're in. We're in March,
It's
right?
after Labor Day.
So April, May, June, July, August, September. So if you don't love it, September, you've got till September to decide to return it. We are doing it's a 180-day return policy, and we are taking $300 off our low HSN price. And by the way, our low HSN price is lower than the doctor's office price. The HSN price is not the doctor's office price. It is our HSN price, and we're doing $300 off of that. We're also doing something called FlexPay. So again, welcome to all of you that are new to watching HSN. FlexPay is if you have a charge card or debit card or PayPal, you break up the payments in even payments. There's no interest or fee, and we ship with the first payment. The first payment, you pay your shipping and your tax. The shipping today is free. And then we send it right out to you. Now, we also have our own in-house credit card called the HSN card. There's no annual fee, by the way, and you save $20 off a single item purchase when you open and use an HSN card for the first time. So go to hsn.com, you can put in the word HSN card in the search, or you can call that 800 number, 695-1418. It's just a way to save a little bit more money, but you get lots of benefits from shopping with the HSN card as time goes by. And again, no annual fee for that. So I know that there's lots more questions. How long will it take me to see results? That's probably something that people are wondering at home.
Okay, excellent question. Because we're talking about growing real hair. That's super important to understand. This is not a cosmetic. This is not a temporary fix, all of which there are terrific things out there for you to use, but we are talking about a real FDA-cleared medical device that's going to help stop your hair loss and help cause hairy growth. So to answer that more effectively, let me explain to you what's going on, okay? Because remember, that's part of what I did in that consultation. We are all born with healthy hair follicles, with healthy hair coming out of those follicles. Because of something vast majority of the time called androgenic alopecia, androhuman inherited alopecia, the medical term for hair loss, that hair follicle starts to die. It's what we in the medical industry called miniaturization. It gets smaller and smaller and smaller until eventually it's gone. That's permanent baldness. So what does the medical community want to do? We want to catch that follicle before it's dead and gone. Remember, I gave you all the ways we do that, right? 3 for women, 4 for men. In this particular case, we're using a very specific color spectrum of light. delivered by a medical grade class 3R laser. I'm getting very technical with you because I know so many of you who are suffering from hair loss spend a lot of time online, and I want you to know that I know what I'm talking about so that you know what's going on. This very specific color spectrum of light that our hair and skin allow to pass through it reaches down to that follicle, is stimulating the mitochondria in the cells of that follicle. So now a follicle with dying cells that is dying itself says, wait, I have what I need to be alive. I'm alive, I'm alive. I'm being an idiot, but it's exactly what's happening.
Right.
The follicle is, I'm alive, I don't have to die. And it literally, guys, if we could show Daniel after I'm done with my spiel here, it'll make more sense. That follicle literally grows to its full, healthy state again, meaning that tiny baby hair that you couldn't even see with your human eye is growing with it. So now let's show Daniel, it's going to make more sense. So when you had thinning hair and you're seeing your scalp in the before, look at that after. So does it make more sense now? So it's not that like new follicles are appearing, there are tiny baby fine hairs there that have come back to life.
Right,
they're filling in.
Right, and by the way, if you have tiny fine baby hairs, don't the bigger, stronger ones push the baby ones out and big ones grow in their place?
Yeah, so if you have when you start a treatment, that's great to talk about. If you start a treatment and the hair is so tiny fine, it will spit it out and start a brand new healthy one. But sometimes it will catch it in time to bring it back to full life. That's why, like, look, I know people at home are thinking this. Wait, how come Daniel looked like that in 6 months and Yvonne at 12 months looks like that? Because remember, genetics. We're all different.
We're all very different,
but,
yeah.
I mean, Yvonne is thrilled that the loss stopped. She's thrilled that she now has bangs, and that the back is better, and the hair is growing healthier, and most importantly, she's only halfway home. Those follicles won't go to full health until about 2 years.
2 years,
so she still has double of that to do.
So let's take a listen to, we talk about some HSN hosts that use it, like myself and Adam, but over at QVC, they have one of their beauty guests, Dr. Denise. She's gonna tell you her personal experience, so take a listen.
My name is Dr. Adrienne Dennis. I'm a medical doctor. I also have a PhD. 2 years ago, I began to see a profound change in the quality of my hair. I have started to use Capillus, and I find it effective. It is very important for me that Capillus is FDA cleared. You put it on your head, you turn it on, one button, and you're done.
Okay, so here, by the way, the little baseball cap it comes with, you could change it out to your favorite sports team. You could change it out to, you know, any color kind of baseball cap. But we're gonna go over to our model, Sonia, and Barry's gonna take you through how easy this is to use. Barry?
And look, we have a visual aid of exactly what you're talking about.
Yeah.
Sonia switched out the black cap that comes with it. You could put any kind of cap. She wanted to do pink, but we're specifically here to show you how simple this is to do. So look what Sonia did. She put it on her head. She has the battery pack in her hand. She's gonna push one button. That one button now turns it on, the lights go on, she heard a beep. At this very second, amazingly, because it really is amazing biomedical technology, Sonia is using a specific medical grade laser light to reach down to her follicle, stimulate the mitochondria in her follicle, and she is bringing all of those back to real, healthy life. Now, what else does she have to do? Nothing. 6 minutes from now, it automatically turns itself off. That means you take it off, you put it in the drawer, you repeat the next day. It really is that simple. And then we always get the question, what are you feeling? Sonia, can you feel anything? Any heat? Any tingling? Nothing. No, really. It's that easy to do. That's why when I say she could be vacuuming or stir frying or dusting or, I mean, look, you guys are home now for an extended period of time. Maybe not. We just don't know. You may have had an appointment to your dermatologist or your hair doctor to talk about these types of issues. You don't know if you can keep it. The great thing is you can get this home, begin treatments. I mean, it ships within 48 hours. You can start doing something about that hair loss using this simple of a method with that powerfulness of biomedical science to really make a change during this time.
Yeah.
And that's exciting stuff, Helen.
It is. And you know, I also like, for myself, I want to say what this isn't. This isn't a pill you're taking every day. There's no, what are the side effects, Barry? I don't want to say there's no side effects. I'm going to ask you, are there side effects?
You know what? Say it.
Are they?
Because the FDA, I have to look this way. I see you way over there. Hi.
Yeah, hey.
Actually, the FDA, I'm looking at you.
Yeah.
The FDA allows us to say there are 0 known adverse side effects. That's huge.
Yeah, I agree.
And Sonia is like a real user in real life, like you, and like Shannon,
Yes.
and like so many who have all gone on record and say, I use this in real life. I mean, that's really comforting because remember those other ones. They are the minoxidil and the finasteride, they're medicines. When you get PRP, you're going to a doctor's office to get numbing put in your scalp, all that stuff.
And you had a list of side effects something about.
So the FDA requires us on those other ones to list side effects.
Yes, I just wanted to be clear, there's no side effects.
There are 0 known adverse side effects that the FDA allows us to actually utter those words. Again, that's super powerful because at the end of the day, now here's where I'll make it super simple for you so it makes sense. At the end of the day, we are using light to treat. Now, there's no mystery that light equals life, whether we're talking about photosynthesis in a plant or human beings and how much we need light in our life to be healthy.
And by the way, you can use this in conjunction with things. Like maybe you're saying, I've got really thin hair, I wear a wig. You could continue wearing your wig and then do this for 6 minutes a day. And then maybe in a year you won't have to wear a wig. You know what I mean? Like this, you could do it with other things that maybe you're like, we sell lots of stuff like True Hair that you put in your scalp to make it look fuller. That you could keep doing those things. You don't have to stop doing any of the cosmetic things you do. So we're talking about other people. Let's take a listen to our very own Adam, and he's gonna tell you his experience with Capillus.
So my dad passed down a lot of wonderful things to me in the course of his lifetime, but one of the things that I'm not so fond of is the thinning hair. And it's something that I kind of noticed over recent years. Anyway, a few months back, I was at HSN and I saw this new product called Capillus. And I thought, well, what have I got to lose? I might as well give it a try. So I've tried it, I've used it. Even my wife has said that my hair's starting to look thicker and fuller, and most important of all, the word that she used was healthier. So yeah, I'm a big believer already.
Yeah, and by the way, in that video, Adam is being very kind of informational about it. I know in real life, it's a very emotional topic.
Oh my gosh.
I mean, it is. Imagine, I mean, he, for a living, is on camera.
Yeah.
Just like, and if you've watched people over the years in your lifetime, we've all seen anchor men and, people that as the time goes by, that it's a big deal. And this is something that you can do. And we were talking before about if you wear a wig or a hairpiece, can you use this still?
Yeah, and as a matter of fact, we just had a call about 4 days ago that the exciting thing is this has been around HSN long enough where we're hearing from you and we're hearing results. A woman called in, you may have been watching, who has been wearing a wig for years. Guess what? She's been doing this treatment. She got this exact cap here at HSN. She grew so much hair, she doesn't wear a wig anymore. Ironically, Helen also mentioned fibers. 10 minutes later, we got another call from a woman who's been sprinkling on lots of fibers. She bought this cap at HSN. She's now grown enough hair where she doesn't have to wear that wig anymore. Now, understand, I've heard these stories a lot. This is because I'm in doctor's offices and sitting with folks a lot, but I'm so excited you get to hear it from people right here who are purchasing this at HSN and hosts here at HSN. But let me just say this, and then I'd like to take you on a tour of our factory so you can see where this is made. But as we talk about being on air and needing hair and people seeing it, I want you to know that I understand what it is that you're going through because I've sat with you. I know there are some of you who barely want to leave the house, even when everything's fine and your health is great. You're certainly not going to go to the class reunion. You even think twice about going to the post office because your hair loss is so embarrassing to you. Gentlemen, you're wearing baseball caps all the time, even with hats. Or even with suits, and you're trying to be cool about it. I understand the overwhelming pain and angst that this puts on your life every single day that you look in the mirror. But if you can hear me say one thing tonight, please hear me say this. I want you to know and understand that medical technology has advanced to the point in the last 10 years where now you can do something about it. Now you can go out. Now, like those callers who called in, you can actually help to stop that loss. You can help to regrow hair. And that is a lifestyle game changer for so many of you. Helen, it really, really is.
So here are some before and afters. This is a young man who wore it 6 months, once a day. Remember, it's only 6 minutes a day. And you can see in the before, you can kind of see through to his scalp, and before, thick hair. It's healthier hair too, because it's the stronger hair, right,
it's
Barry?
growing to the healthiest you can, and make no mistake, you can cut, color, perm. This is your hair at its healthiest state. There's nothing else you have to buy. This cap is it, and you're gonna grow the healthiest hair you can.
Okay, now so after 12 months, worn once a day, by the way, we do a 6 months return or exchange policy, and you will be able to see results before 6 months. Here's an example of 3 months. You should be beginning to see results by 3 months, worn once a day. And you can see the thinning spots are filling in. This person in a year, I can't wait to see. If this is them in 3 months, I can't wait to see them in a year or 2 years, right, Barry?
Yeah, and this guy's name's Lester, and I like to bring him because he's right at the point where he's looking in the mirror and saying, I don't think I'm losing any more hair, which is really all most of these folks really want. They just don't want to lose any more hair.
Let's just put the brakes on the hair loss.
Exactly.
Right.
And now, though, he is probably not visible to the human eye. At about right now, he's going to start reversing that miniaturization, and it's going to start to fill in. That's why it's no mistake that HSN gives you 6 months, because it's really going to take that long until not only you see it in the mirror, but long before you see it in the mirror, your neighbors, your coworkers, everyone else is going to see it and commenting, and you're going to know you're home free.
So how are these made?
Okay, that's an excellent question, because these are assembled here in the USA. What we do is we source products from all over the world, the best we can get. We take it to our manufacturing facility in Miami, and I love to show you this because I want to mention what you're not seeing. You're not seeing conveyor belts or machines or plastic being molded and shaped. What are you seeing? You are seeing skilled medical technicians who you can just look at them and know they've been doing this for a while. They are literally soldering in one laser at a time. This is not like a machine thing, like a fake knockoff that you might buy online. You can see quality control. You can see compliance. This is the place that's inspected by the FDA regularly. This is a place where we hire people to inspect us in between FDA inspections, because we want to be that compliant. Because again, remember, this truly, when I say this is the one doctors give to their patients, it really is, because you may have seen something in the past that had 8 lasers. So we're talking 1, 2, 3, 4, 5, 6, 7, 8, this little strip amount of lasers. Then you may have seen something in the past that had 40 lasers. So we're talking like maybe right here might be 40 lasers. What this is 202 lasers giving you a professional grade treatment like a doctor would give to you, that you are delivering the most amount of energy that you can deliver to your scalp and to your hair follicles to get amazing results that you can get here at HSN. But again, exactly the ones that doctors give you.
And by the way, you saw when Sonia lifted up the cap, the light came off. That's a safety feature, because it's only supposed to be illuminated when it's on your head.
Exactly, and that's a patented safety feature that we stuck in there.
Yeah, patented safety feature and excellent coverage. That's what Barry was just talking about. Assembled in the USA, Miami, Florida, if you'd like to know exactly where that is. And also, I have a question for you, though. This is a question I don't think I've ever asked you.
Oh, good, yay.
So don't be scared.
Come on, let's do it.
You know, I think there might be some people watching at home who think, you know, maybe a guy's like, you know, my dad lost his hair and I'm 25 and I'm not sure. Could this be like preventative? Like, is this something you could go in if you think that's or is that not really a great idea?
Wait, so if you can be prevented of what? Say that again?
Let's say you haven't experienced like a significant hair loss.
Oh, you're afraid it's going to happen.
You think it's going to happen because you come from a long line of people that like I'll tell you, in my family, my dad lost his hair, my brother lost his hair. It's like the writing is on the wall.
Absolutely 100%. Here's the deal. So I showed you that chart of guys, not that we have to show it again, but those class 2s would come into me all the time and say, I don't want to get to a class 3 or a class 4. But do people do that even beforehand? Actually, they do. There are people who use this as a beauty product. Now, I'll be straight up honest with you, because I told you I'm going to be real. That doesn't make me real excited. I get it. You might as well.
Right.
But I get excited about the medical people. I get excited about people like me, because I started losing my hair in my 20s.
Right.
I didn't have this, which is why there are some areas on my head where there is no hair, because I had no choice. There was nothing to do back then.
So you have more hair than when we started working together.
Well, there's no question.
I'm telling you. I said that before the show.
And the thing is, I have so much more hair up here than I would have had this technology not been around. So, and again, let me be clear who this is for and not for. Right here, ask me how much I love using myself as an example.
A lot.
I know, right?
Good.
Oh, gosh, I know, but no, I did this because some people come into my office and go, dude, where's your hair? And I say, well, let me be very clear, okay?
Right.
These follicles were gone before this photobiomodulation went through the clinical trials, was cleared by the FDA to hit the scene. However, this hair up here, there was still fuzz and it looked a lot worse, but I was able to catch it in time. So keep that in mind. Guys, if you're shiny bald, because it mostly happens to guys, rarely women, sometimes but rarely, this is not for you. We're not gonna recreate a follicle. What we're going to do is take follicles that are dying and bring them back to life. Full-blown, healthy follicles, translation, full-blown, healthy hair. Does that make sense?
It does make sense, it does. And by the way, if you're just tuning in, we're at the half point of the show. I'm gonna be shopping with you for 3 hours, well, 2.5 now, because we're halfway through this presentation. There's a lot of information to get out, and I know it's a significant amount of money. $1,700 is not like, oh, I'm gonna like impulse buy something. This has to be something that you've been thinking about, that there's, maybe even a psychological element to it, that you don't want to go out, you don't want to see friends, you don't want to, now none of us can go out, none of us can see friends, but maybe it's time to kind of take a moment, do some research, see what the choices are. Barry went through them. There's 4 choices for men and 3 for women in the marketplace that are FDA cleared, approved. This is an FDA approved device to not only stop losing hair, but to actually regrow hair. If you have a follicle, it can be saved, is basically it. So give it a try. We have a 180-day return policy. During these very challenging times, HSN has extended all its return policies to 90 days. But this particular product has 6 months. You've got till September. Buy it now. If you don't love it, you can get your returns or exchanges all the way up until September. So I did want to mention that. Now, if you're a longtime HSN shopper, we have lots of amazing guests here, and one of them is a famous hairstylist from Tabitha's Salon Takeover. His name is Martino Cartier. He's a big celebrity hairstylist that has his own line here, and this is just, he's not endorsing this. It's not like we're paying him to say this. He wanted to do this video because this is a product he uses. So take a listen.
My name is Martino Cartier, celebrity stylist. When I turned 40 years old, I noticed my hairline was really starting to thin and I was starting to panic. So I found a hair restoration surgeon, world-renowned guy, right here in Florida. So I went to him and I had the transplant. I spent a lot of money and he told me, you really should protect your investment. And by doing that, I want you to get this Capillus laser cap. And what it's gonna do, it's gonna stop the hair from falling out that you already had with the surgery. Plus, it's gonna help other hair come in thicker and more fuller, like when you were younger. Being a celebrity stylist, I have access to the best of the best. So if I choose Capillus, you should too. FDA approved, clinical results, you're gonna love your hair.
And by the way, when you order, you get a case to keep it in.
Yep.
You get the Capillus itself. It comes with, you don't have to be plugged in when you use it. It actually has to be, you charge it, there's a charger, and then it's portable. You just push this button, it lights up for 6 minutes, use it once a day for 6 minutes. You put a hat on your head for 6 minutes a day. That is all the compliance, because compliance is a big deal. You've talked to me a lot about compliance.
It's huge.
Because some of the other choices, I will say that I did try other things, and I think they do work, the spray, but sometimes I did it, sometimes I didn't. I'd have my hair styled. I didn't want to spray it and ruin the style because I have to go.
And that was the
I'd
problem.
skip it, and you can't ever skip it.
Meaning you didn't comply.
I didn't comply.
Right.
So compliance is a big deal. So this is very easy to comply with, but let's talk about, what does FDA clearance mean? Like, what does that even mean?
Yeah, that's so powerful. And again, I love it that these days we're hearing so much more about the FDA and the power of that agency. And we're actually hearing folks from the FDA, when they come on camera, we're specifically talking about the coronavirus and how they're going to look for treatments. You hear them specifically talking about how they're looking for efficacy and how they're looking for safety. Now, you've actually heard me talk about those things for a year, because that is the standard to being FDA cleared or FDA approved. So let me be very specific about this, because again, we're becoming much more educated consumers here. This technology, when you get the box home and you open it, you are going to see on that box a seal that says this is FDA cleared, because it is FDA cleared. So what does that mean? What that means is you can see those lasers right there. These are not LEDs. These are not Christmas tree lights. These are lasers, because it takes that. What that means is the FDA looked at these lasers, this specific technology, and looked at the human clinical trials and all the research done by the physician investigators and said, yes, this technology has what's called efficacy or effectiveness, or that this will do what the manufacturers claim it will do, which is help stop hair loss and help cause hair regrowth. But even that is not enough. You then have to go on and prove to the FDA something called, not something called, but safety. So it doesn't matter that this is effective, it also has to be totally safe. After you prove that through human clinical trials, that's when you get the FDA clearance. And Helen, that's why I hit that so hard. And I did it in my office with people, and I want to hit it with you, because at the end of the day, people don't have to take my word for it, or yours, or Martino's, or Dr. Dinesh, or Sonia, or Adam. I mean, we could keep going on and on. At the end of the day, the FDA says this technology is effective and safe. And that is something to really put your, with no pun intended, but to hang your hat on, because you've had so many questions for so many years, and you need to know that FDA clearance holds all that weight.
All right, and we'd like to take a listen again to Dr. Dinesh, who is a beauty expert on our sister network, QVC. So let's hear her personal experience. Take a listen.
My name is Dr. Adrienne Dinesh. I'm a medical doctor. I also have a PhD. 2 years ago, I began to see a profound change in the quality of my hair. I have started to use Capillus, and I find it effective. It is very important for me that Capillus is FDA cleared. You put it on your head, you turn it on, one button, and you're done.
You know, it's funny, this time that we're going through is so weird, but I find myself at home like, did I whiten my teeth? Have I used my Glow Pro? Like, point. I'm sort of like I'm thinking about what are the important things that I'm gonna do, and Capillus is really like on the top of the list.
Well,
because would I rather have hair or white? Like, if I had to put it in order, I think hair is kind of like up there.
Well, you know, it's funny because our clothes, makeup, there's so many things that we change every day.
Do you know,
hair is something that we have all the time, which is why people are so emotionally invested in doing something about that. And look, during these uncertain times, the chances are most of us will have a job waiting for us whenever we can go back to it, regardless of stimulus packages and all that. But, you know, everything is shifting and everything is moving. And the sad reality is our society puts so much emphasis on hair, right down to the point where we know statistically that people look at how much hair you have to determine how healthy you are. I think it stinks, but it's a reality. That's why we naturally feel that pressure. We know people with better hair get promoted more, get better jobs, have a better social life, obviously have a better dating life. So even people who want to do something, let's say you decide you want to do something in 2020 and go to the doctors and do something about your hair, you can't even go to the doctors for elective things right now. So to your point, this really is an excellent time in history to really sit home and, even though it's only 6 minutes once a day, really finally address something that's been bothering you for a long time.
And you know, there's other things. I'm going to tell you something else. The person I color my hair. That's not a mystery to everybody at home, and I'm sure there's lots of people are experiencing a million things. One of which is that salon closed down. My hair colorist put in my mailbox yesterday a couple of products, formulas for me I colored my own hair yesterday.
Are you serious?
I did, yes.
Wow.
I did. I should have done a video for you guys because it was hilarious. I used a Debbie Meyer green box at a barbecue baster, and
This is the time. This is the time we live in, right?
We're doing what we can, but my point is that there's things you can do at home, like my friends that are actual hairstylists were like, couldn't even look away. I couldn't believe I was doing that. But I will tell you, this is not that thing. This is the thing where if you can put a hat on your head and push the button, this is a very easy home thing to do. It is not, FYI, coloring your hair is I'm not going to recommend that to anybody, but I will say this I will recommend to everybody. It is not this, okay, a professional person can put a hat on your head and push a button, but you can't do that yourself. No, this you can do yourself.
Yeah.
You can do yourself. It makes a huge world of difference.
And you saw that factory footage, right? This ships from our factory.
Yeah.
So within 48 hours, this is on your way home, and you can actually do something at home to get this going.
Right, Barry doesn't come on air unless we have them in stock, by the way. And if you're new to HSN, that's how our business works, is we constantly are moving through products.
Yeah.
So we have Barry, I think, for like another week. And then that's what I think you have a few more shows, but I know you're taking a week off.
Because I'll get people all the time who would say, I went online and it was $19.99 again. And I'm like, absolutely, when they say this is a special, it really is. It's not like always that price.
Right, it is not. It's $300 off. The FlexPay is $282.17. And I just want to repeat what FlexPay is if you're new. It's any major credit card or debit card. You put down your first FlexPay, your shipping and your tax. Your shipping is free. So your first FlexPay and your tax, and we send it right out to you with that first payment. Now, each month, the FlexPay appears again on whatever charge card or debit card or PayPal or whatever you paid with, but there's no interest, there's no setup fee, no hidden fees, no nothing. It's just literally divided the price. It's like an interest-free, loan or whatever, but we send it to you right away. Now, if you have 6 months, so at the end of this, if you by September, if you don't love it, you could still return it. You could return it if you want. We're doing the longest exchange and return policy on anything that we do at the network is Capillus. We give you 6 months because truthfully, you're not going to see results in a day. You're not going to see results in a week. You're not going to see results in a month. You're going to see results starting in about 3 months. And then they're going to get better at 6 months.
Because real hair.
In a year, they're going to get better. And in 2 years, you're going to be like, I don't remember why did I use Capillus? Keep using it though.
Absolutely.
But how many hats do I have to buy? Do I buy one every year?
No.
Every 2 years?
No, exactly. And I know you know the answers. You're setting me up. Because this is important.
I'm going to throw you a softball. You got to hit it out of the park.
Here comes the softball.
How many hats do I have to buy?
Yeah, one. Because remember, we talked about the minoxidil and the PRP and the finasteride, all things you have to do over and over again for the rest of your life. So remember how much all of that will cost for the rest of your life. This one, not only do you buy once, but ironically, it's also one you can share. So if there's a husband and wife or husband and son or sisters, you can share. There's nothing else out there that you can share like this. Yeah, it's not. And this is so let me give you a quick tour while we're here. If you can come in, guys, look at these lasers. Come in nice and tight, and you can see I'm pushing. This is a hypoallergenic silicone gel layer. There are tube-like things that are these class 3R lasers that the medical community uses on actually many applications, in this case to treat your hair. But this is something that comes with a lithium-ion rechargeable battery. We'll take a walk over to our model in a second, Sonia, to show you again how it uses. You recharge this maybe once a week. You push the button, you're completely free with this flexible cap, hyperallergenic silicone gel layer. You put it on your head and you begin your treatment. If you want, you do your treatment, you say, Joe, your turn.
Right.
Really, you can share it. But yes, to your question, you buy it once.
You buy it once.
Yeah.
And by the way, we're going to take a listen again to our very own Adam Freeman, who has his own personal experience with Capillus. Take a listen.
Well, I suppose it's a confidence thing, when you look in the mirror and you start to see that your hair's getting a little bit thinner, and then it just kind of builds up over time. So when I found Capillus, I thought, well, I'm here at HSN, I might as well give it a go. I'd seen it on TV that it only takes 6 minutes per treatment, so I did it and I tried it. I'm starting to see the difference. My hair's feeling thicker, fuller, and it looks healthier. So yes, I'm definitely happy that I took the chance on Capillus.
So let's take a look at some before and afters.
Yeah, you know what? This is super important because let's face it, the proof is in the pudding. When folks came into my office, this is really what they wanted to see. And while I showed them this, I also spent a lot of time teaching them the science because I thought that was so important. But let's start with Daniel, okay? Look at Daniel. Daniel is 6 months into using this product. Let me again make this very clear. This is this specific cap that you are seeing here with us right now that Daniel used. Look at the before. Daniel would come into my office freaking out that his hair was falling out. My hair's falling out. We need to stop my hair from falling out. I would say, Daniel, here's the great news. We can not only stop your hair from falling out, we can actually help to regrow your hair. I think that's making more sense since we've looked at that animation of the follicles. You can see how that hair filled in. This is Yvonne. This is 12 months later. Remember, we're talking about biology. You're all going to grow and respond differently to what happens on the top of your head once you begin your treatments. The great news is, though, you got 6 months to see for yourself. Now, Yvonne came in, part getting wider, freaking out that it's going to get wider like she saw happen to mom and grandma. She wanted to do something about it. She was happy just having it stop right there. I was able to say, Yvonne, we don't have to stop right there. We have an FDA-cleared medical product that you can use at home 6 minutes a day and actually fill it in. Lester would come in, just wanted to stop his hair from falling out. I like to show Lester at 3 months because, as you see at 3 months, that's exactly what happened. His hair stopped falling out. He is just now on his way to growing hair. And the great news is, it couldn't be more simple. All these folks did, again, to be clear, using this exact cap we're talking about that Sonia has in her hand right now. All they had, which by the way, she flipped out the black cap and put on her own pink cap, because you can do that. The science is inside. What's on the outside is totally up to you. But all she has to do, and she does this in real life, by the way, put it on her head, pick up that charger that we showed you, push one button, and her treatment has begun. 6 minutes later, it will automatically turn itself off. What she does after that is goes to that drawer back there behind her, pops the cap in there. If she wants, pop it in the hard shell case. I don't. I literally stick it out. I'm going to walk back here because I want to show you guys how easy this is, because I get these questions all the time. So there are drawers here, right? She literally takes that cap off. I'm still keeping the 6 feet from her. Takes that cap off, sticks it in this drawer. I want to show you how simple this is. She doesn't even think about it for, what is that, 23 hours and 54 minutes, okay?
Yeah.
23 hours, 54 minutes later, she comes back to this drawer, gets that cap out, puts it on her head, pushes that one button, and she's done. And Helen, that's so important to use because, as you mentioned, you brought up compliance, which is perfect. In medical offices, we always talk about compliance. The best heart pill in the world is no good if you don't take it. In this case, there are some things that you literally have to do for hours a day, or put on your head 24 hours a day and leave there. This is 6 minutes once a day. And when really, truly, when you look at meta-analysis out there where they compare all four of those side by side, this outperforms them all.
Okay, so we're going to talk about the animation when you're taking a look at this follicle, about what's actually happening. By the way, when Sonia lifted her hat, the light goes off. That's a safety feature that's patented. It's only on when the lights are on, when it's on your head. But here are the follicles, Barry. What are we looking at?
Yeah, if we could see what was happening under Sonia's scalp, literally, what's happening is follicles are dying. It's called miniaturization. They're getting smaller and smaller and smaller until they're gone. What does the medical community want to do? We want to catch that follicle before it is dead and gone, because that is permanent baldness. What we're going to do here is use a very specific color spectrum of light, 650 nanometers, that we know our hair and our scalp will allow to pass through it, stimulate the cells in that follicle, and actually have that follicle say, wait, I don't have to die, I can live, I can live, I can live. And it is doing that, and it's coming back to full life. So as you saw, Helen, in those before and afters we've shown, that's what's actually happening.
Right, and we're doing a special price. We've got about 10 minutes left in the show. So if you want to call in, if you picked it up, or if you're watching and have questions, I know we've answered questions from past callers, and we've had testimonials throughout the hour. It is a product that has a 180-day return policy. It does not work overnight, so I want to make that clear. But what it does do is stop you from losing hair and regrow your hair without any side effects, 0 side effects. And it's something that you do in your own home for 6 minutes a day. And you don't have to say, well, should I set like a kitchen timer? No. You push the button and it's on. When it goes on your head, it illuminates. And then 6 minutes later, it just turns itself off. So there's I like that it's a no-brainer. On your head, push the button, it stops. You can leave it on your head all day if you want, but the light only goes on for 6 minutes, and it'll beep when the 6 minutes is up, so you don't have to wonder, should I take it off? Do I need to look under there and check? You'll kind of get a feel for it. But is this a different one?
It is a different one.
Oh, okay. So
Yeah.
Adam Freeman, our own HSN host, is going to tell you a little bit more about his experience with Capillus. So take a listen.
So my dad passed down a lot of wonderful things to me in the course of his lifetime, but one of the things that I'm not so fond of is the thinning hair. And it's something that I kind of noticed over recent years. Anyway, a few months back, I was at HSN and I saw this new product called Capillus. And I thought, well, you know, what have I got to lose? I might as well give it a try. So I've tried it, I've used it. Even my wife has said that my hair's starting to look thicker and fuller, and most important of all, the word that she used was healthier. So yeah, I'm a big believer already.
By the way, first of all, thank you, Adam. We do have the Capillus Activator available, and my producer told me that we only have a few hundred available.
Yeah.
It's also on auto ship. It's half price. Well, not exactly half price. It's about 20 cents off of half price, but $60.95. It's $30.50. What is the activator? How do we use it? Because a lot of people are ordering it on auto ship.
Yeah, and it's, can you slide it? I know you don't want to.
Oh, yeah.
Okay, so I can show.
Yeah, I'm allowed to slide it.
We got one over here. Okay, this is actually a really cool thing. I want to make it very clear that you don't have to buy this to buy this. Because I know some people think, okay, what aren't they telling me? No, when we're talking about the cap, that's all you need. However, like anything, there are some things you can do to add a little zip or a little boost to it. I describe this as kind of like fertilizer. If you're planting grass in really good soil, it's going to get great sun, it's going to get great water, the grass is going to do great. But you can add fertilizer to maybe help it along. That's what this is. I bring it out here because I've talked so much about some of the topicals that are greasy that people don't want to put on. This will actually dissolve right into your scalp, okay? It's loaded with amino acids, which is going to add elasticity to your scalp and to your hair. It also has in saw palmetto, green tea extract, lots of things that are known DHT blockers. Again, I'm saying those things because those of you who are suffering from hair loss.
But that's not minoxidil or anything.
No, this isn't. It's a whole different natural type of thing.
Okay.
And you can see it's already gone.
Okay.
So, but I'll tell you, we talk about people wearing weaves.
Do you put that on before the hat?
After your treatment.
Oh, okay, after your treatment.
Yep.
Okay,
yep.
thank you.
And you leave it on, but it's like, you see it's gone. I mean, it's totally gone. It's nothing oily. But it's just really good to add a great kind of base to your hair. So even if you don't get the cap, we were talking about weaves and that type of thing.
Yes, let's talk about that.
Yeah, because see, you have to understand, people think alopecia is like a medical condition, and while you could argue it is, what it really is, it's a medical term for hair loss. So there are types of alopecia. There's androgenic alopecia, where you inherit hair loss. It's usually no mystery. Exactly what this cap is FDA cleared for. What we're talking about, weaves and those type of things, is something called traction alopecia, where you've yanked on your hair so much, whether it's a weave or cornrows or braids or tight ponytails, and you're noticing your hair is going away. Will this do great things for that? Absolutely. It's going to give you healthy follicles. But in terms of the activator, it actually adds some elasticity to your scalp and to your hair that's going to help that as well.
Oh,
does that make sense?
Yes, it does.
Okay, and if you're suffering from androgenic alopecia, again, I could get so medical all day long. One of your biggest enemies is DHT, dihydrotestosterone. This has natural things in it that blocks dihydrotestosterone, like saw palmetto green tea extract doesn't. It's actually loaded with great stuff. I'm a huge fan. Okay. Huge fan. But you don't need it. You don't need anything but this, but if you really want to take that extra jolt, why not?
Okay. All right, let's take a look at some results. We've only got about 5 minutes left in the presentation. If you would like to order, now is the time to do so. Do not forget, you have 180 days. You have until September for returns to return the product if you find out it does not work for you. Here's somebody after 3 months. Remember, it's once a day, 6 minutes, and it's on a timer, so you don't have to worry. You push the button, it lights, it'll illuminate inside the hat, and then it'll automatically turn itself off. So you don't have to do anything, and it's 3 months. Now, take a look at this guy after 3 months. He's got to be like
6 months.
Oh, 6 months. After 6 months.
Yep.
And by the way, I wonder what he's gonna look like after a year and after 2 years.
Guess what? I know that answer.
Oh, what?
You know what? Because I saw someone who knows him probably about 4 months ago. I said, man, Daniel's results are amazing. They told me guess what? They're even better now.
Oh, really?
Yeah.
I'm not surprised.
Because you're going to grow your healthiest follicles that you can.
Yeah, exactly. And again, you only buy one cap. It's not like one cap once every 5 years, once every 10 years. You only buy one cap. How long do the bulbs inside there last? Like, how long will they last, the bulbs?
Was it you I corrected once, or this, or Shannon? Because they're not bulbs.
Oh, you know what? They're not.
You know, here's
you
why
have corrected me.
Because when you say bulbs, it sounds like something you're going to have to unscrew and replace.
Yeah, right.
No, they're lasers.
They're lasers, sorry.
The lasers themselves, let me just say, will last decades and decades.
Decades and decades and decades.
But that's important. So, no, but Helen, what an awesome question, because no, that's what you have to understand. There is nothing to replace in the technology of this cap. They are lasers, and they don't function like a light bulb you have to replace. However, let me say this. In 10 years, might you have to replace this? I'm going to say probably not, probably, right? Because it's a lithium-ion battery. We've had cell phones. Even though this is very high quality, it's going to last a long time. Or you could get this home and the dog could eat it in a month.
Right.
What are you going to do? Well, here's the great news. We're based in the USA with an entire customer service department that actually wants to help you with everything. So if you get this home and you're like, wait, I forget, how do I turn this on? Wait, do I have to turn this off? Wait, what are those lights that they're talking about? Call us 5 times a day. We're not a one and done where we're going to say, here you go, see you, bye-bye, good luck. We are going to, not only you get a 2-year warranty, but even well after that 2-year warranty, we are very much there to help you because we want to walk you through this.
Right, and I'm so excited for your results and that you're going to feel more confident, you're going to feel younger, you're going to feel like, okay, that date or that job interview, it's like, having, great teeth, white teeth, having hair, and I will tell you that this is something with no side effects. It is a one-time purchase, and I know it's a significant amount of money. We are doing a sale where it is $300 off our HSN price, and the HSN price is not the same price as in the doctor's office. And I'm gonna tell you something actually, I think it was on my honeymoon. I was on a cruise ship, and I took a picture to show you.
Oh, that's right.
Because they actually sold it on the cruise ship. It was not that price on the cruise ship.
And that's what Martino says. He paid a lot more for one of these models.
Yeah, because I know he bought his elsewhere. So we have one of the best prices in the world. I don't want to say the best price in the world because I don't know everybody's single price on earth, but definitely shop around. We're very excited.
I think you do. I mean, watch someone. No, because we're very serious about our price because it's a real medical device. And when we say we really sell these in doctor's offices, we really do. So, but I'll tell you something else. A doctor isn't going to say, you know what, just pay me a little bit every 6 months.
Right.
In 6 months, if you don't like it, bring it back. And I'm not trying to minimize that stuff. But
no.
Without sounding condescending, what HSN when you say HSN believes in this product and has truly partnered with Capillus, they really have, and they would never offer those types of things if they didn't see the clinical trials and really go through it as much as we do to see that this is a real FDA-cleared medical device that can be offered to you. And that's what makes this so exciting for the HSN customer.
Barry, when are you going to be back on again?
Maybe Sunday. but here's the thing, because times are crazy.
I know.
When I go away,
we can't say.
When I go away, that price goes away, and I only say that because I really have had people say to me or call me,
when you go away,
$19.99
we don't know when you're able to come back.
Right.
Because things are changing very quickly.
But if you
for
get
this
it today,
show, we're guaranteeing you the price for the show.
Yep.
And we're also doing free shipping for this show and giving you 6 months to pay it off with no interest and no fee. And that's any major credit card. Congratulations to everybody that's starting the first day of the rest of your life with beautiful hair, Barry.
Good
Wonderful
way to
job.
say it. I like it. Bingo.
Yeah, why not?
Thank you. Love it. Thank you, Helen.
So much. All right, guys. Stay with us. We have 2 more hours shopping together, but we did something on our homepage. It's called the Home Checklist. And on it, all the products have free shipping and handling, and we have all the categories that you're needing right now. Cleaning supplies. We have things to, boredom busters, like, televisions and, stereos. And also, how about some great soap? The Beekman 1802, amazing soap, skincare, things for the perfect workspace. I know I did a show the other day, and my husband, who's working at home, bought a really great new mouse for his home office that he had to build. And we also have food if you're hungry. So I love that. But we've got more to come, including exercise equipment. I'm going to be doing that coming up next.
Hi everyone, Susie Orman here. Finally, after 9 years, I have the book that all of you have been asking for, The Ultimate Retirement Guide for 50 Plus. This book is for you. Don't miss it.
Explore your creative side as we wrap up National Craft Month. Tuesday is our big finale on HSN with 6 flex pay on all crafts. Get crafty with us Tuesday and anytime at hsn.com. The appraised values you see at HSN are set by independent, professionally certified appraisers. They determine, as closely as possible, the approximate retail cost of replacing or recreating the item, not the possible sell or purchase price. Because subjective estimates and judgments are involved, appraisals may vary by as much as 25%. Call your customer service rep for more information.
Well, I'm so glad you're hanging out with us and chose to watch HSN today. My name is Helen Keeney. I'm your host, and we're going to be doing some things for your health.